welcome Dr. Reem for today's session. Thank you so much for making it for today's session. Before we start, I just want Dr. Reem, if you could kindly introduce yourself so that all of us know about you, and then we can
Welcome,
start.
Dr. Reem, for today's session. Thank you. All right. Thank you so much for inviting me. I hope that I answer all the questions and I be of help to everyone who's interested in OB-GYN. I'm Reem. I graduated from RAC MHSU in 2019 with merits. I finished internship in Saqr and Safe Hospital in RAC, and then I worked as a teaching assistant and then as a GP, and now I am an R1 resident in OB-GYN in Tuam.
All right. Dr. Reem, before we start, we are really happy that you could make to this session today. How as why did you choose OB-GYN?
All right, so that's everyone asks this question, and from my perspective, it combines the best of both worlds. It combines both medical practice and surgical practice. You get to do so many things hands on and a lot of procedures, and of course, there's a learning curve. But once you master something, it's amazing. And honestly, I remember the first time I was in a normal vaginal delivery, I was just, holding the hands of the patient. I wasn't doing much. But once the baby was out, I cried. The mother didn't cry, I cried. So I think that's when I knew that OB-GYN is for me.
All right, that's really, really nice to hear, holding a sentimental value to your
Mm,
specialty of choice. And I hope that you really make a good OB-GYN specialist and consultant in the
thank
near
you.
future.
Thank you. Hopefully.
Um, Inshallah. So, Dr. Reem, many of them would want to know what the specialty is like. Is it really competitive to get into? Because it's one of the core specialties, right?
Mhm.
So, what is your take on it?
It is definitely competitive to get into because also it's a surgical program. So it's 5 years here in UAE, and in the UK it's 7 years. And as you said, it's a core training. It's not coupled like if they're thinking about it in the UK. It's not a coupled training. Once you get through ST, you finish all the 7 years and you graduate as a consultant. So definitely it's competitive here and it's competitive in the UK. In terms of seats, so last year under the HAD or the DOH, there were 4 seats in Tuam Hospital, uh, 2 seats in Corniche Hospital, and 3 seats in Danat Al Emirat. And for DHA, I also know they offer about 4 seats every year, and it's also competitive. And unfortunately for MOH or EHS, I don't think there is, they still don't offer OB-GYN residency. Maybe they do this year because
Okay.
every year they start opening up new programs under EHS.
Correct, you're right.
Mm-mm.
Because the major chunk is in the HUD and in the DHA.
DHA,
So
yeah.
most of the residents are in these two
Mm.
places. Uh, if you were to talk about OB-GYN in detail, how would you describe this as a residency program? How is OB-GYN residency program?
So, in general, as I mentioned, it's 5 years surgical training. And I will talk about how our outline is in TWAM. So, we have OB block, we have gynae blocks, and of course, we do on calls during these slash ward coverage slash ER. Be it OBER like pregnant emergencies or gynae emergencies. Then we also have to go for external rotations, so our externals, we have emergency, NICU, ICU, IVF, OB medicine, oncology. And now we're also starting to, that's for the seniors actually, they're starting to go for laparoscopy in Dubai, 1 month or 2 month block, I'm not sure. And one more thing, actually, all of the programs all over UAE are now applying for the Emirati board. That
Correct.
is a tier 1. So right now, what we're doing is the Arab board, which when you finish off, whether it is 4 years for medicine or 5 years for any surgical, you become a specialist. However, they're trying now to implement this Emirati board, which is tier one. So you finish your years of training and you are a consultant. So
Oh,
we're still in
wonderful.
the application process. I'm not sure about the other the other specialities, but for OB/GYN they're applying.
Okay. So do you think that this is going to have a major difference in the outline of the structure of the program?
Definitely. So, because to qualify for such a tier one thing, we have to have, I think, more external rotations. I think, like in
Correct.
surgery and other subspecialties of OB/GYN and other specialities. So the road is still hazy, but we're managing as we go.
But since we're talking about OB/GYN, what are the other departments you rotate in as a part of your residency program?
So I already finished rotating with emergency medicine. Lovely people, shout out to them. They're all so sweet. And this year also I'll be doing an NICU, the neonatal ICU, and then there is the adult ICU and oncology because it's only gynae onco, so it's not I'm not yani, it's not going to be with other departments, it's going to be in our department but with the oncology doctors.
Okay. So, since Obigan is a medical and a surgical field, you feel that all these subspecialties are going to give you a wide
Mhm,
exposure
mhm,
during your residency training. That's
mhm,
actually a really good point that you said because, emergency itself is one of the
mhm,
major things when we look at getting patients. That's the first line of getting to know about a patient. So, that's really important to have a look at. Oh,
And like
yes,
just to add, like we usually tend to forget that even if it's a pregnant woman, she can have other medical diseases. Like she can
absolutely.
have PE, pulmonary embolism, appendicitis, surgical abdomen. There's so many things. But for some reason, whenever people see, pregnant woman, خلاص, call OB/GYN.
Yeah, I mean, a review is really necessary in those situations. But as you really mentioned, that's really nice that other specialties
You
need
have
to have a look in as well. Because yeah, if it's an appendicitis, there is no role for OB/GYN. Surgery has to take the patient in. So yeah, you're right about that. It's a teamwork at the end of the day when different
definitely, definitely.
specialties will look into managing it. So since you made it into OB/GYN, what do
Mm,
you feel are the qualities that are expected from a resident to
mm.
apply for OB/GYN?
Okay, so we have to be really resilient because there are tough days and there will be days where you're just wondering, what am I doing? Is it all worth it? And all that. So you have to go in with a strong mindset. You have to go in with the mindset that, okay, if it's just a bad day, whatever it is, it's gonna go away and a new day will come, you know?
Correct.
Because, of course, with the stress and you see, we have a reputation that obigani we're always so stressed and we're always running around and we don't interact with others, and it's kind of true, it is very stressful. So we have to be yani, prepared to deal with the stress and not to take things personally from others. And you have to be also very patient because also you have to understand that this is the patient's most vulnerable time. So of course they may
Correct.
get mad at you, they may become emotional. You have to be prepared for all these things. I think someone asked if I'm an IMG or a UAE. No, I'm a UAE graduate. I've
Okay.
seen it
I think they
somewhere.
meant local or
No,
non-local.
expat.
Expat, yeah. Don't worry about the questions. We'll take them at the end. So
All
just
right.
not to disrupt our flow of your thoughts and the way
Mm-hmm.
you're beautifully explaining it to us. One other thing, since we are at this moment, there's always a misconception that OB/GYN is reserved only for females. So what's your take on that? Does the program accept male candidates, or it's only for females, or how is the system here?
Unfortunately, yeah, here in UAE, it's only females.
Okay, so not only Abu Dhabi, but everywhere it's only female.
Only in, yeah, only females in the United Arab Emirates. However, if we do have males with prospects, of course, there's the UK, there are the other Arab countries. For instance, I'm Egyptian, and in Egypt there are so many male residents in OB-GYN, and even I think in Lebanon and these areas, and of course, US, UK. So not to
Correct.
discourage anyone.
That's a really strong point. Yes, because there are some people who would want to apply
Mm,
in this position as well,
mm,
and because since I was an intern, I was rotating in Latifa Hospital in Dubai during my
mm.
internship, and I was surprised to see that there were male consultants.
There,
So it is
there,
possible to get
there
into this
are.
career.
But they are not trained here in the UAE. That's the thing. So
Correct.
they come from outside, already specialized or already consultants, and most of the males they work mainly gynae cases or
Correct.
high risk OB or oncology. So training itself is not here in UAE, unfortunately.
All right, perfect. No worries. I think that's clear for most of them because that's one of the questions that keeps arising in their minds.
Mm,
Coming down to applying for this program, what do you feel is necessary when you're appearing for the interview for the program?
mm. So, as I've mentioned, very limited seats as compared to other specialities. So, you have to make yourself stand out, you know. So, of course, there is the EMRI, get a good score or at least secure passing, the passing marks, and of course, a good CV that is, of course, as your time as a student and your grades. They do make an impact, but also it's your involvement in researches, having had any publications. This is kind of also what gave yani, helped me because I had already publications in regards to OB obstetrics during my time as a student and intern. So of course that was a plus. And just showing an interest in research and methodology, because I remember I was asked a couple like two questions emergency, and then I was asked in detail about research and if you want to do this and what's your steps and what's your approach. So they really care about this aspect. And if you have any extracurricular curricular activities like volunteering, or especially during the COVID time, or you volunteered in the hospital for, I don't know, there are some programs where you can just, be assisting around. And also having done any external exams, so I finished off my plabs. Again, that was a positive push of my CV. As yani, I'm not going to say as compared to others, but I was told this in person that I stood out a little bit more than the other applications.
Speaking of which, when you have to make your profile stand out,
Mm.
what do you think holds more importance at the time of the interviews? Is it like your Emory score, or is it
Mm.
your portfolio? Is it your research? What?
I would say, but again, this is not like the most official advice. I would say it's the portfolio, the CV, how much you've achieved, how much you've done, how much you're interested. Because scores, I know people who had high scores, really high scores, and they still didn't get through. And it's not just for this specialty, it's for also for other specialities. I think it's a balance of things. They don't just look at one thing, they look at, okay, maybe not a just passing score, but really keen and interested in this and had researchers. So I would advise to, of course, focus on the scores, at least secure passing, but don't rely on it 100%, if you're catching my.
Correct. And again, coming down to the same question of interviews, do they focus on asking you more of medical related questions? Do they
Mhm.
ask you personal questions? How is the interview structure like?
So it was 20 minutes. First, I was asked, and again, this is not just for TWAM, this is for other, because I've interviewed with other hospitals as well. They first ask you two medical questions, and they ask, of course, emergency, one emergency case, and maybe one clinic or cold case, and then they ask you personally. So Of course, the golden question is, why you? Why should we choose you? Talk about yourself in 5 minutes or less. So make sure again that you prepare a concise but straight to the point introduction, glamorous introduction of yourself and your achievements. And then they look at your CV. So again, this is why I say portfolio matters, because they dissect your portfolio. So one hospital focused on the researches, the other hospital focused on my grades and my marks. So it really matters what you put in your portfolio and know what you've written there. Because
Mm.
I've received this advice and I was like, huh? But then it made sense, because really, you're sending the same CV for everyone and all that, and then you don't pay attention to what's written there, and then they just like read in the last page, they read something and they ask you about it. So be well versed of your portfolio.
Yes, correct. Because as
Mm-hmm.
you rightly mentioned, the CV is like a digital representation of you. So if
Mm-hmm.
you don't know about what it's in there, it's a negative impact during the interview. You're right about that. So I think the interview point would be clear from most of the students. There's another hinge that many people have is that do local graduates that have graduated from UAE apply and get through easily, or
Mm-hmm.
can IMGs also apply? So what's your take on that?
So by local graduates, you mean like anyone who's graduated in the UAE versus
Yes,
IMGs? Ah, okay. Well, I would say there's of course priority for the UAE graduates, but again, I know that there are IMGs who have joined, but not this year, maybe last year or so. They were accepted. And actually, personally, I know a couple of people in my program who did graduate from other countries and they joined here and they were accepted. So again, it all mattered on their portfolio, not
correct.
not just IMG. And anyways, we have the Emory for everyone. I also the IMGs can sit for the Emory, and this is like a standardized test for everyone to put them
Correct.
in their centiles. So there is a chance.
OB-GYN was your first choice. You would have
Mm.
had second or third choices as well, right?
Yeah.
So now, since you are in OB-GYN, it's a very fair question to ask. What do you feel is the advantage of your program compared to the other programs?
Hmm. So advantage wise, I to be very honest, I chose it because it's what I wanted to do. It's what I like to do. Like I applied to other fields, I just couldn't, picture myself continuing with them. But advantage wise, we in TWAM specifically, we are aside from the Arab board, we're also going for the Canadian board and the American board, and we have logbooks. We have an electronic logbook and a physical logbook we fill of all the procedures that we do, be it a normal vaginal delivery or a cesarean section or perineal repairs and of such. So we all have to keep track of everything that we do, and it, later on, if we want to apply anywhere like abroad, we can submit these as our physical proof of competency.
Okay. And on the contrary, the limitations in your department as an OB-GYN resident and what things can become better for you. It's a
Oh,
very cliche question.
limitation wise, I wouldn't say it's a limitation, it's just a challenge. And I think this applies for all other departments as well. But there's this balance between services, covering services versus learning. So
Correct.
oftentimes I find myself, running between patients and all, but at the same time there's an interesting case in the OR that I want to attend, or there's like an interesting delivery or something, but again, I'm running around in between the wards. So it's a challenge, I think, that applies everywhere. It's not just for OB-GYN, you know.
So it's like a universal thing that is
Mm.
becoming, a norm, but there are solutions that are coming up for
There
it.
are definitely there are that, yani we can cover each other if we're going for, like just few minutes or half an hour or so, we can cover each other, or we can, finish off our work and then run. It often comes at our own expense, the expense of our
Correct.
health. But
Yeah,
that's what
it's
it is. You have to grab every learning opportunity.
correct. Correct.
You know.
You have to just analyze which one is more important at that moment and
Mm,
grab onto it.
mm, mm,
Speaking of this, since you mentioned about OR, I wanted to
mhm,
know what is the experience like in the OR for residents? Are you given hands-on
mhm,
training? How much exposure do you get? Or is it like depending upon a junior and a senior that you are given
mm.
cases? How is it?
So of course, from the start, we're not, as juniors, it's like a step ladder type of approach. The more you show your competency with suturing and basic handling of instruments and all, the more you be given opportunities. So I'm gonna say you have to show your worth. You have to show first that you're interested and that you're practicing and that you're learning. You're not expected from day one to be perfect and to master everything, but you're expected to show improvement. And for now, we work under direct supervision. So, for instance, if I'm given to close the rectus or the subcut or the skin, I'm working under supervision. However, for my seniors, if they're given to close or to, it's gonna be without supervision or like from distance. And also, if they're given to open, that is, make the incision and deliver the baby and all, again, this is all under direct supervision
So as
within the OR. Mm,
okay. So, for example, if you are in a procedure and
mm,
you are with a consultant who is going to trust you with the cases, you can
mhm.
elevate the amount of hands-on procedures you have.
Definitely,
Perfect. That
definitely.
sounds fair enough as well.
Mm,
On the contrary, since we talk about shifts as well for the working time, how is an on-call in OB/GYN like?
I'm not gonna say a discouraging word, but sometimes it's crazy because it's only 12 hours, but then you
Okay.
have also handover time, and then emergencies happen during handover time. So suddenly you're handing over, then there's bradycardia, and you just go for a class 1 cesarean section. You can't help it. Some days we stay way over our
Hmm.
our on-call schedule timing, and then we have to come back the next day for an even crazier call. So it really depends on our luck, on our patients. In TWAM, they're all high risk patients, so that's the thing.
Okay.
In TWAM, we're the only hospital with an NICU in a line. So any
Okay.
high risk case from private gets referred to us, or they from the start they start following up in TWAM and they're booked with us. So
Okay.
we call, we one call we have bombs, as we call them. The next call it's calm, it's quiet. You may never know. You have to come prepared for whatever.
Similar to a surgical call as well. Sometimes you have a calm and quiet one, and sometimes you have a
Mm,
terrible one.
mm,
That's
mm.
right. So, your own call, is it only you covering it alone, or you have protection along the way? Like you have your senior.
So, so for on calls, we get divided both in OB and yani OB resident, and then there is a
Okay.
resident for gynae. So
Okay.
let's say it's a weekday. We have the OB resident covering the L&D from 8 to 8 or from 9 to 9, and then there's another one coming at night. And these also cover the antenatal and any pretty much OB emergencies. Similarly, there is the gynae ER call. Again, it's 12 hours, and we only do it during the morning. We don't cover night calls for gynae. And again, they're expected to cover. First, we have residents for wards, but then they leave at 5, and then after 5 till handover time is covered by the emergent the call person.
Okay, so basically it's a protected call, and you have your seniors with you, and
Mm-mm.
you can attend to any emergency at that moment. That
Yeah.
sounds really
Mm.
perfect. Like it gives you a very good learning opportunity as well, I feel.
It is. It's definitely good learning. As juniors, of course, yeah, we're coupled or we're shadowing our seniors, but
Hmm.
again, we're also expected to be extremely hands on, because how else are we supposed to learn if we're not doing things hands on?
Correct.
We're again, as I told you, it's like a step ladder type of thing. So first you're like a little baby, but then you'll have to start covering calls independently. It's just you and the specialist, or it's just you and the consultant. So you have, how do I say this, you have to lose this sense of security and protection that there's someone higher taking care of you. You have to be take responsibility of your patients, and look for them, look out for them. Don't rely
Correct.
someone else is gonna do it, or is gonna look after you.
Correct. Correct. On the different aspect for training is the learning opportunities, right?
Hmm.
As a resident, you need to be exposed to learning materials
Hmm.
by your seniors or consultants. So what do you feel is like an academic day or the learning opportunities you have for residents?
So you mentioned academic days. We have those 3 or 4 every month. And during those, we sit and discuss the latest, like someone would present the latest updates and guidelines, and we will sit and brush up. And of course, we have a consultant attending it, one of the academic affairs affiliated consultants, and we sit and discuss. And then we'd have also some hands-on training sessions, be it like instrumental delivery on a mannequin, or suturing, or hysteroscopies, or laparoscopy. We usually have also hands-on training sessions. So that's the academic part of it. And again, academic day is protected time except for the on call person, but everyone else is expected to attend. And if we're not on leave or anything, even if we're off that day, we are expected to attend. And hospital wise, like on patients, like let's say in the L&D, as I told you, we work under direct supervision. So there is the supervision of the seniors, the specialists, or even the midwives. You learn a lot from them because they've been trained for like what, 30 years. So I think some midwives are even more knowledgeable than doctors. So that's
Correct.
another tip for anyone who wants to join this field, is that always respect your midwives, respect your nurses, because they know more than you do. And you just hold them and squeeze the knowledge out of them, and all the skills. Like they taught me some tips and tricks for suturing and all that. It's really nice.
That's really good to hear. What about research? Does your department give you a chance to do research? Are they mentors who guide you on it?
Mhm.
How is that?
So again, being in TWAM and seeing all the high risk cases, it's like a pool for for research. A lot of interesting cases, a lot of rare cases and management and all. So just few at the beginning, no, not this month. Beginning of March, we had the International OB/GYN conference, and I remember most of the presentations were done by our residents, especially case presentations. The hall was just our residents presenting cases from
Wonderful.
what we've seen in in previous years. I myself haven't got the chance to present yet. I'm preparing something. But of course, if you see an interesting case, you can immediately do at least a case report and publish it. That's the least. And of course, there are other researches ongoing. There's stem cell research that I've heard about, and there's plenty of room for researches.
So the consultants or the faculty, they are interested in giving you exposure to research as well.
Yeah, if you see an interesting case, just approach whoever was managing that case. And of course, we also approach our PD, our program director, and just make an outline, a proposal, and you're good to go.
Perfect, perfect. You also spoke about conferences, and
Mm-hmm.
how does that work for a resident? Like, since they started presenting as well, that's a really big milestone as a resident.
Mm-hmm.
How do you feel is your program giving you exposure to these things, and how often does this happen?
So often I can't answer because it depends on how many conferences are happening during that year. But really, we have a very keen program director who always pushes us to do researches, or she's pushing us now to do researches and to present and everything. And also, we have a research officer, one of the residents. So she's keeping track every now and then. She sends us, a conference in Japan, the conferences, upcoming conferences in the UK and all. So it's like um, is my image okay?
I think I lost your screen.
Yeah, I think I think so too. How to fix this? Can I don't know. Should I exit and join again?
I think yes, you can exit and rejoin the same link.
All right. Sorry.
No worries.
Uh,
Yes, we are back.
Sorry for the
No
interruption.
worries.
So, as I was saying, we have a research officer, one of the residents. She keeps forwarding call for abstracts in worldwide conferences. She's like a
I think
hawk.
that's a really, really good
So,
step. Like, the program itself is motivating residents to do research, to present in conferences. So
mhm,
I think anyone who's looking for this as a career prospect, it's a really good field,
mhm,
because it is a cumulative of medical and surgical. And I don't think so you get to experience that in any other specialty per se,
mhm.
right? So
I
it's correct, exactly. Speaking of which, there's one thing that, again, like, since you're managing a very massive load of the hospital, which
Mhm,
is both in medical and surgical side, how do you feel is your work life balance? Because I know it's going to be stressful, it's running
mhm,
between patients. How
mhm,
is the work life balance, and how do residents look
mhm,
at it to de-stress themselves out of
mhm.
this?
So work life wise, because we are on rolling rota. That is, if we are, let's say, in the OB block, we have 3 weeks of on calls, but then we do on calls like 3 days, and then we're off for 2 days, and then let's say weekend calls. So we get to, and we know our rota like, how do I say this? Like by monthly basis. Because I know some
Okay.
specialities, they get the rota on weekly basis or something like that. But we get it on monthly basis. So we can definitely arrange our timings and our things around it. And I know like most of the residents, I know they have really good work life balance. Like mashallah, they all have lives. They all go out. They go to the gym and they go to Dubai and stuff. So I would say they have work life balance going on. As for me, I find it more challenging to balance my studying and my working, because really, you give all of your energy to your work, and then you come back, you're just drained. You don't have time, you don't have energy to study. So that's my personal struggle, but it's doable because my seniors did it. So I will do
Correct.
it. Well.
I think it's the one of the most important take in this is to know your priorities. So once you list them out well, because obviously a day is 24 hours, you don't get more than
Mhm,
that. So
mhm,
it's difficult to do everything you have in mind on that particular day. So
mhm,
jotting down priorities and trying to complete them as they go is one of the
mm,
ways to get through this
mhm.
balance. That's a really
That-
nice point that you raised. Speaking of which, I know that there are other hospitals which will not feel the same way as Tuam because
mm,
of the massive caseload here. But
mm,
other than the massive caseload and more opportunities you're having, how do you feel your department is different than the other hospitals
mm,
with the same department?
mm. So again, this is I'm not gonna say like 100% sure this is what I hear from other residents and all, but again, they don't get as much exposure to surgeries, to cesareans, compared to us. Like they don't get to open or to close from year one. Maybe it's as they progress as seniors, or some of them don't even too. But again, this is like what I heard on the low. Nothing officially has been said. So I feel we are, yani, skills wise, we are a bit better than some other programs.
Okay, that's really nice.
That's the most
Uh,
strategic answer.
I think that's the best way to approach it also, because when you're
Mm,
looking at a complex field,
mm,
there's always a gray area, so you have to always look into that as well. Uh, Also, again, there's another interesting question that I have with the residency itself.
mm,
Many of them, when they join residency programs, they look at a career timeline, like five
mm,
years down the line, 10 years
mm.
down the line. So do you feel that there is career progression with this field in this country or abroad, or how do you feel your program will be supporting you?
So, actually, we have some of our specialists, they are ex residents.
Okay.
Some of them, they have graduated like 2 years ago, and some are a bit older. So, it's really nice to see how much or how far they've progressed, how far they've come. And of course, they're the best teachers. The ex residents are the best teachers because they know the struggles, and they know how it is. You have to show your worth and to fight for the cesareans and all that. So they're honestly, they're the best teachers to learn from. And you've mentioned this, the career progression. It's again with like every other field. If you finish off here and you finish off the Arab board, you become a specialist. You can work as a specialist, or you can subspecialize, do a fellowship abroad, let's say also in UK, or a fellowship in the US. And then let's say the beauty of OB-GYN is that there are so many subspecialties. There's the fetal-maternal medicine, in vitro fertilization, gynae urology, gynae uro yani, oncology. There's so many fields to work in, even endocrine, like OB medicine. There's endocrine, for the GDMs and the thyroid issues and all that. So there are these two options. I don't know. I would say also teaching would be a viable option as well if you get too tired of all the clinical stress and clinical work. There's also teaching.
Yes, since you mentioned about teaching, there is a very good position of an academic surgeon where you
Mm,
can be a surgeon by the day by being in the
mm,
OR, looking at the cases, and then also
mm,
teach students if that's what your passion is also about.
mhm,
That's a
mhm,
really good point. And one other thing, since we are talking much more about the program in general,
mm,
there is one thing that I always try to highlight or end it with is the timeline that you go through. So, for
mhm,
example, you what is it like in a day for
mhm,
an OB/GYN resident? So, since the time you wake up to go back, so
mhm.
how does it like? Where do you go? Which departments are you in? Where do you rotate? What patients do you see?
Mhm. So as I've mentioned, we have a rota. We have, if you see our rota, it's all colors, it's all blocks. And when we first saw it, we were like, "What is this puzzle?" But then once we started practicing and using it, we kind of know where each one is posted. So in a day, let's say, in by morning time, we are, let's say, 10 residents, and each one knows their allocations. So there is the L&D call, the on-call team. There's the L&D, and then there is someone covering the antenatal ward. and someone covering the elective cesarean OR. And then there is the gynae again, gynae emergency, and then gynae wards and gynae elective cases of OR. And then usually we have some of the seniors, they are in external rotations. So it's, you see the rota is like very nicely organized. And of course, if there are any shortages, we are expected to cover. So let's say there are shortages in the MAU, that is the maternal assessment unit, OB emergencies, we cover that. Any shortage in postnatal, we also cover. So this is where like the trip up may happen. But from the morning, we all attend, the morning meetings. We all know our rotas, and we are released to our work after the morning meeting. Each one goes to their spot and does their work.
This is where, cumulatively as a team, they all take care of the OB/GYN department, the
Mm-hmm.
frontline warriors for everyone. That's a really, really, really good way to put it.
Mm. And yeah, of course, if like the OB on call team, they're going for an emergency cesarean, the gynae covers for them. So of course, as the day goes by, as emergencies happen, we have to allocate ourselves.
Correct. One other thing is, since you mentioned that, the stress factor,
Mm.
the running between patients, and the work-life balance, what is the way that the residents and Obigani try to do to
Mm.
avoid burnout? I'm sure that there would be some instances and stuff that you would be undergoing to manage the situation of acute stress.
Well, acute stress, we just, we've learned, I think, I'm not gonna speak for everyone, but this is what I see most of the people doing, is that we've learned like once the day is over, you just throw it behind your back, move on. You don't think about it, because even, there are some situations, some encounters with your peers, with the other residents, with the seniors, the consultants, and all. You get some heated moments due to stress, of course. So just chuck it behind your back, and post call wise, again, I wish I was that type of person that goes to the gym post call. I'm not. But I know people who do, like they finish off 12 hours and then, oh, let's go, this is how they relieve their stress. So each one finds their own, mm, how do I say this, a coping mechanism.
So, does the department also play a role in coping mechanisms for everyone, like going
Mm,
out, trying to arrange something for the residents? How does it
we've
work?
we've been trying, but the problem is we as someone is always on call, so you can't get
Correct.
the whole team to go out for
Correct.
activities. But there's been like, so far this year we haven't done anything, but I know from previous years they have had activities, fun activities. Oh, and also this year they had, but I was on call. That's why I can't recall it. But they had,
Correct.
they had something.
All right. I think that was very beautifully explained about the program. I think everyone
You.
who's just watching this will grab everything about Obigani if that's a specialty of their choice.
And if anything, if anyone, please feel free to contact me on Instagram. Just message me if you have any questions. I always answer. And I try my best. I give to the best of my knowledge. Like, if I don't know something, I'll say I don't know. But I'm always free and open for anyone to ask any questions.
That's a really kind-hearted soul for everyone out there. However, can we just take a few questions if you don't
Sure.
mind? We just on the chat. I think we discussed about the work-life balance,
Mhm.
and someone wants to know which year of residency are you in?
First year, R1.
First year. So still a budding OB/GYN.
I'm still in my
Okay.
cocoon.
Out of the cocoon already. Okay, so someone asked, you are done with PLAB, so why did you continue your career in UK? Is the
Mhm.
system here in UAE more good than UK?
So it was more of a personal choice, but of course, the UK has its own merits. As I said, it's already a recognized tier one. If you get accepted there, it's also competitive over there as well. But
Correct.
once you get accepted there and you go through all the 7 years, and one more thing, their training, they rotate every year or so. They change hospitals and they change the counties and the cities they're in. So again, just look, if someone's considering to go to the UK, because of course it's a tier one, just consider the personal aspect of things, because that's that
Well,
that was my choice.
I think the only difference between the UAE and the UK pathway would be the timeline or the
Mhm.
time to get through the career progression.
Is it?
Because in
Mhm,
UAE you are already into the residency program,
mhm,
but in UK you have to join as an FY2 or an FY1,
mhm,
then
mhm.
get into ST or core SHO, and then
Yeah.
build your pathway in either non-training or training, and then that's a bit of a hassle if you
So
get matched.
yeah, there is of course for IMGs you have to go through the FY. If you've done your internship, FY1 is okay, you're exempted from, but you have to do an FY2 or an equivalent
Correct.
equivalent of that, and then of course you apply for the training versus core training, that's for internal medicine and such. So there are more number of years, and I don't know, I can't comment of course on the exposure or the training or the skills because I haven't done it myself, but you finish off your consultant, so
Correct.
that's
Correct.
that's a huge merit.
Exactly. So that's all
Mm.
about
Like
evaluating
pros
the
and
pros
cons.
and cons. Yes, exactly. That's the word there. All right, perfect. Someone wants to know about, can you explain your GP chip thing? Like, is it easy to get in?
So back then, that was in 2021 to 2022. I started for the MOH licensing exam, and I heard there was a vacancy in one of the primary healthcare centers of MOH. So I just applied. I sent in my CV and my evaluation letter, and I had an interview and I got through. But the recent hirings, they are with temporary contracts. Later
Okay.
on, of course, if you want to stay and how do I say this? They want to keep you with them. They can offer you like more of a permanent contract, but now the hiring tends to be on temporary contracts. So that is like a three months contract up for renewal. So again,
Okay.
as a GP, that was an amazing experience. I got to see, like a lot of family medicine cases, the diabetes, the hypertensions, the stuff. Now I see these things and I'm like, consult internal medicine.
Well,
Not
you're
my
out
business
of your
anymore.
privilege zone. So this is actually a very interesting point that you said, because since you worked as a GP and then you're
Mhm,
here as a
mhm,
resident, and
mhm,
then I'm sure that there are many residents in your field that who might have joined just after their internship.
mhm, mhm,
So what do you feel is the difference between the two type of people?
mhm. There's not much difference because I know like most of the people I know, they've also were held back for whatever reason a couple of years. So there isn't yani that feeling because technically I'm 2 years I don't want to say delayed because I was doing so much during these 2 years. I was also working as a TA and as a GP, but I really don't feel there's much difference between me versus the current R3s. Let's say there isn't much different. Of course, there's difference in skills wise and experience wise because they're more senior to me, but personal affairs and all, there's not much difference.
You're always going to pick up with
Mm,
experience within the coming years, so that's
mm.
not going to affect you much.
Yeah, no. So I really don't feel like I'm held back or anything.
Perfect, perfect. And someone else also asked, I think we answered that question as well as a teaching assistant as well. So I think, yeah, we have covered a bit of questions. Before we end, would you like to give any advice to the budding Obigani residents who wants to join?
So I don't want, of course, I don't want to discourage anyone, but it's really, really challenging and it gets really, really stressful at times. So if you're going for it, make sure that this is truly what you want, because at times it can really eat eat up your life, you know? It can be your whole
Correct.
thing. And sometimes, late at night, you just sit and think, did I do the right thing? Did I manage this correctly? Did I, you know, there's so many implications. And I find it a beautiful field because I I for one don't like chronic patients. I don't like seeing the same patients every day. So there is that. There is a really high turnover of patients. Like the maximum you see them is two, unless things have gone really wrong or they're really high risk, you see them for a week or so. But otherwise, high turnover of patients. Alhamdulillah, most of the time it's satisfactory results, happy outcomes. No matter how complicated the pregnancy was, it's a good outcome for the baby and the mama. One day she's screaming and she's crying. The next day you see her with her baby, she's smiling, she's making dua for you. So this is really, really, all fulfilling.
All right, perfect. I think that sums up the explanation for everyone. And I thank you so much for taking time from your busy schedule.
Thank you. Thank you for
And
listening to me. That's so much.
yes, thank you so much. It's a pleasure. And I hope everyone enjoyed listening to you. And if they have questions, I will share your ID with your
That,
permission so
yes.
that they can reach out to you as well.
Thank you. Thank you. Definitely do that. Please feel free, everyone, to contact me if you have any questions.
Perfect. Thank you so much and have a good day.
Same to you. Bye.
Bye bye.